everyone and welcome. You're watching Eagle News America. I'm Anna Clee coming to you from Las Vegas, Nevada. It is Sunday, November 15, 2020. Tonight we have updates from several of our correspondents across North America, starting with Bureau Chief Thomas Leikness in Edmonton, Alberta.
Protesters complain about COVID restrictions as case numbers continue to grow.
Aaron Aben in Gaithersburg, Maryland.
Maryland allots $70 million to new investments and initiatives. Metrics steadily rise.
Mila Simbulan in Swarthmore, Pennsylvania.
Pennsylvania urges federal government to reauthorize Pennsylvania National Guard to carry out missions assisting long-term care facilities affected by COVID-19.
In Las Vegas, Lori Jarvina.
Nevada launches Stay at Home 2.0 and Governor Sisolak tests positive for COVID-19.
Frendil Faharan in Seattle reports about Washington State riding a raging wave of COVID-19 cases. Next, we have Marianne Borja in North Hills, California.
Over $135 million from CARES Act funding provide ongoing food resources to financially impacted communities throughout LA County.
Monique Nolasco in Baton Rouge, Louisiana reports about several stories. A Louisiana governor staff member tests positive for COVID-19. Louisiana to remain in phase 3. East Baton Rouge Parish COVID cases increase. And New Orleans announces COVID-19 live entertainment permitting process. Plus, learn how to make grilled salmon with avocado cucumber salsa with some of our EBC friends in Hawaii. And for our virtual roundtable discussion, in observance of America Recycles Day, we will talk about how we help take care of our environment. Our coverage begins now. First, an overview of today's COVID-19 numbers. According to the Coronavirus Resource Center of Johns Hopkins University in Medicine, as of 6 p.m. Eastern Time, Sunday, November 15, 2020, the number of cases of COVID-19 reported worldwide is now more than 54,200,000. Top 3 on the list of countries with recorded cases, with U.S. as number 1, close to 11 million, followed by India with 8.8 million, and then Brazil at 5.8 million. Sadly, more than 1,315,000 lives worldwide have succumbed to this virus. Again, top 3 countries with the most number of COVID-19 related deaths are U.S. with more than 245,000, Brazil more than 165,000, and India more than 129,000. Now on to our stories. 15 Asia-Pacific countries on Sunday signed the world's biggest free trade deal, seen as a huge coup for China in extending its influence. The Regional Comprehensive Economic Partnership, or RCEP, includes 10 Southeast Asian economies along with China, Japan, South Korea, New Zealand, and Australia, with members accounting for around 30% of global GDP. First proposed in 2012, the deal was finally sealed at the end of a Southeast Asian summit as leaders pushed to get their pandemic-hit economies back on track. This agreement to lower tariffs and open up the services trade within the bloc does not include the United States and is viewed as a Chinese-led alternative to a now-defunct Washington Trade Initiative. Many of the signatories are battling severe coronavirus outbreaks, and they are also hoping the RCEP will help mitigate the crippling economic cost of the illness. Indonesia recently tumbled into its first recession for 2 decades, while the Philippine economy shrunk by 11.5% on year in the latest quarter. Deborah Elms, executive director of the Asian Trade Center, a Singapore-based consultancy, said, COVID has reminded the region of why trade matters, and governments are more eager than ever to have positive economic growth. Meanwhile, thousands of Donald Trump's supporters thousands of Donald Trump supporters rallied for a last dance Saturday in Washington, chanting 4 more years and blaming fraud for an election defeat that will force the president to vacate the White House after just 1 term. Trump himself made a dry pass in his armored motorcade on his way to play golf, smiling through his limousine window to wild cheers and signs saying, "Best press ever," and "Trump 2020, keep America great." The Republican incumbent is sticking to claims of mass fraud and claiming the defeated President-elect Joe Biden in the November 3 vote, marking another unprecedented challenge to U.S. democratic norms as his time in office runs down. Later Saturday, he took to Twitter with a series of tweets and retweets that included claims of voting machines potentially being hacked and complaints about news networks' coverage of the rallies. Twitter slapped labels on at least 8 of the posts as containing disputed information. At least 10,000 people, few wearing masks, massed on the city's Freedom Plaza before marching towards the Supreme Court, brandishing flags in a raucous atmosphere reminiscent of a Trump campaign rally. With right-wing militia group the Proud Boys also among those attending, a large security presence was deployed to prevent clashes with anti-Trump events outside the Supreme Court. Groups of counter-protesters stood nearby, some yelling about social justice and Trump supporters not wearing masks. There were a number of scuffles, but no major violence had been reported. By late afternoon, Washington police said there had been 10 arrests, including 4 for firearm violations and 1 for assault on a police officer, without providing further details. Former President Barack Obama says in the first volume of his upcoming memoir that the divisions in America run deep, and the departure of Donald Trump from the White House will not be enough to bridge the divide. In an excerpt from A Promised Land, which goes on sale on Tuesday, Obama, America's first black president, reflects on the 4 years since he left office. The 59-year-old Obama said in the excerpt published on Thursday in The Atlantic, quote, "Our democracy seems to be teetering on the brink of crisis, a crisis rooted in the fundamental contest between 2 opposing visions of what America is and what it should be." He said the crisis has left the body politic divided, angry, and mistrustful. It has also allowed for an ongoing breach of institutional norms, procedural safeguards, and the adherence to basic facts that both Republicans and Democrats once took for granted. Obama said he was encouraged by the election victory of his former Vice President Joe Biden and his running mate Kamala Harris, and their character and capacity to do what is right. President Donald Trump appeared to edge closer towards acknowledging his election defeat in a tweet on Sunday morning as he again rallied against supposed mass fraud in the vote won by challenger Joe Biden. Trump tweeted in his clearest yet admission of defeat, "He won because the election was rigged. No vote watchers or observers allowed. Vote tabulated by a radical left, privately owned company," said Trump. Trump has refused to concede the election and repeatedly said he intended to overturn the result through legal cases, though no evidence of mass fraud in the November 3 election has been found. But the first 2 words of his Sunday tweet, 2 days after a slip in which he said, "Time will tell if he remains president," seemed to bring him another step closer to admitting defeat. Now on to live updates. In Canada, protesters complain about COVID restrictions as case numbers rise. Bureau Chief Thomas Leikness joins us tonight. Thomas?
Thank you, Anna. Well, I've got to wonder, what does it take? For the past week, coronavirus numbers in Canada have hit record highs. Scores of people have died, and some people don't seem to think this is a serious situation. I mean, fortunately, they're in a minority, but they are also the ones that can transmit the disease and have the potential to become super spreaders. I'm just so frustrated when I hear about things like this. On Saturday, yesterday, in the province of Manitoba, a group of about 200 people, they call themselves Hugs Over Masks. Sweet sounding name, Hugs Over Masks. They decide to stage a protest. Now, Manitoba that day reported a record number of deaths, 15. This protest was staged in the small city of Steinbach. It's just a stone's throw away from the capital of Winnipeg. What seemed to be bugging these people? Well, they don't like the government's public health orders to slow the spread of this deadly virus. Now, in that city of 21,000, Steinbach, Manitoba, there were 263 active cases on that day. Across the province that day, 15 people died of COVID. The emergency room in that city is so crowded, so many people coming there, that nurses are doing triage in the parking lot. So what are these people thinking? They say they don't like the fact that gatherings are limited to 5 people. They don't like masks. They don't like to be told what to do because I guess in their minds, this isn't a serious illness. And they think they know more than most doctors. One of them even told a television network she's upset because she can't get together with her friends like she used to. And all I can say to that is, boo-hoo. Others that were out there touting their conspiracy theories, the tinfoil hat gang strikes again. Well, authorities handed out lots of tickets. Haven't got an exact number yet, but the fines are just under $1,300. For those of you in the Philippines, that works out to more than 47,000 pesos. Maybe that will help the message sink in. The scary part is this type of thinking isn't just limited to Steinbeck, Manitoba. It's going on across the country. Small pockets of people, they're just a minority, but that minority is dangerous, and I'll tell you why. It's because they don't take the precautions, and as a result, others that do get infected. They worry about their rights being violated. Well, perhaps they should consider this. This quote attributed to Abraham Lincoln. He said, "My right to swing my fist ends where your nose begins." Now, I know the EBC audience doesn't need to be reminded of this because you're all responsible members of society, but you're probably just as frustrated as I am watching the antics of the few. While we fight this pandemic together, I wish you all good health. Remember to take care of others. Take care of yourselves. Stay home, stay safe, and stay tuned to Eagle News for accurate and balanced coverage of the COVID-19 pandemic and other current affairs. In Edmonton, Canada, Thomas I. Likeness, Eagle News. We live in interesting times. Back to you, Anna.
Thank you, Thomas. You're absolutely right. I wish we could just all, be on the same page as far as the pandemic and, that it is real. And if we all just do our part, it will get better, faster, right? I was wondering,
it's just so frustrating.
Yes. Canada's population is a lot smaller than ours, a little just, if I'm correct, maybe a little over 10%, right? So the case numbers are smaller. So just how bad is it there?
Okay, as of today in my province, there's only about 12 more intensive care beds left for COVID patients. And once those are gone, it could affect the healthcare needs of others. And I'm talking about heart attack victims. The accident victim who suffered severe trauma in a car crash, people who have other serious medical issues, people who suffer complications from surgery. Where do they go? In Saskatoon, Saskatchewan, it's so bad now that they're reserving those intensive care beds just for people who live in that city. They won't accept out-of-town patients anymore. And they are shipping patients out of town who are less severe, who are able to be transported because, again, there's just not enough space. COVID patients need that kind of care once they get that seriously ill, and that's really putting a strain on our healthcare resources.
Yes, I mean we're starting to hear similar stories again as when the pandemic started, with hospitals not being able to handle all the cases. What about there? Are hospitals still able to cope, Thomas?
Well, most in Alberta and many other parts of the country have begun to reduce the number of elective or non-urgent procedures they can do. So, for example, you have a bad knee, you need a knee replacement. You've been in pain and on a waiting list for a year and a half. Now, it's going to be longer now before you can get in. 9 hospitals in my province are coping with outbreaks within the hospital of coronavirus. Now, that means staff who have been in contact with infected healthcare workers, they now have to quarantine. This results in staff shortages. In some cases, though, the health department is allowing asymptomatic staff who tested positive to still report to work. There's also mandatory overtime to cover shortages. And I'll tell you, this is just creating a lot of stress for doctors, for nurses aides, for anybody involved in that hospital setting.
Yeah, so we need to continue to, support our healthcare workers. They're being stretched far more thin than in the beginning, I would say. Well, thank you, Thomas, for your report. It's always a pleasure to have you on.
Thank you, and you take care.
Thank you. When we come back, updates from our Eagle News correspondents in Gaithersburg, Maryland, Swarthmore, Pennsylvania, and Las Vegas, Nevada. This is Eagle News America. Stay with us. Welcome back. You are watching Eagle News America. I'm Anna Cui in Las Vegas. The state of Maryland allots $70 million to new investments and initiatives. Plus, COVID metrics in the state steadily rise. In Gaithersburg, Aaron Aben has the details. Aaron?
Thank you, Anna. In March of this year, U.S. Congress passed the Coronavirus Aid, Relief, and Economic Security Act, intended to reduce the impact of COVID-19 on the economy nationwide. Back in October, only 35% of the CARES Act funding was spent. Now the remaining CARES Act funding will go towards the following. $20 million for the Maryland Department of Health to fund for PPE to build up the stockpile of supplies such as gloves, gowns, and masks. $15 million for Maryland Department of Labor for unemployment insurance measures, expanding call center staffing, improving customer service management software, and fraud detection measures. As of Thursday, around $8 billion in benefits has been given out to more than 640,000 Marylanders. Next, $10 million to the Maryland Department of Community and Housing Development for relief for renters. The Assisted Housing Relief Program helps low-income residents in state-funded properties who've been impacted by COVID-19. Next, $10 million towards mass vaccination planning, $10 million to support area food banks, $2 million for emergency supplemental resources to the State Department of Human Services for foster care, $2 million for Supplemental Nutrition Assistance Program, or SNAP, and energy assistance programs, $1 million for innovative wastewater testing initiatives, and in addition to initiatives towards economic recovery, the state's Department of Commerce is in the works of distributing $50 million in direct relief for the Restaurant Relief Program. The Department of Labor has started distributing new payments to small businesses for the Layoff Aversion Fund. This program has saved over 12,000 jobs. The third round of payments from Maryland's Small Business COVID-19 Relief Grant Fund is expected to be disbursed soon. On Saturday, Maryland reported the highest single-day increase of cases, 2,321, since the start of COVID-19. Adding today's new cases of 1,840, the state now has 165,930 confirmed cases. The statewide positivity rate increased to 6.57%. Just last week, it was below 5%. Coming from Gaithersburg, Maryland, Aaron Aben, Eagle News. We live in interesting times. Back to you, Anna.
Thank you, Aben. As you mentioned, the small businesses, I think they are the hardest hit of the pandemic. So $70 million, that's quite a lot. So what do you think about the government expending that now rather than previously or even in the coming years?
Well, personally, I think it's a relatively appropriate response to the increasing positivity rates and hospitalizations in multiple Maryland counties. Although using the funding in advance to help out small businesses previously in the year would have been helpful, I think it's a smart idea to increase the amount of PPE we can have proactively to mitigate the aftermath of the current spike in cases.
Yes, absolutely, since especially with the rising numbers there as well. Well, thank you, Aben, for your report. Thank you for joining us tonight. The state of Pennsylvania urges the federal government to reauthorize the state's National Guard to carry out missions assisting long-term care facilities affected by COVID-19. In Swarthmore, Bureau Chief Myla Simbulan joins us this evening. Myla.
Thanks, Anna. The state of Pennsylvania is now experiencing the highest in daily increase with about 5,400 additional positives. That's why the Pennsylvania government, with the support of U.S. Senator Bob Casey and U.S. Representative Chrissy Houlihan, is urging federal government to allow Pennsylvania National Guard members to carry out missions that assist long-term care facilities affected by COVID-19. Here's Department of Health Secretary Dr. Rachel Levine to tell us more. Take a look.
All of this was made possible because of the federal government approved Title 32 authorization, which has allowed state National Guard members to respond to the COVID-19 pandemic in their communities. There are approximately 250 Pennsylvania National Guard members who are protecting Pennsylvanians as part of this authorization, and it's critical that this continue. So I would like to...
As the nation expects spikes in COVID-19 cases in the coming months, this renewal is much needed to ensure the National Guard is able to support efforts and to maintain National Guard operations without additional burden to states and territory. The National Guard has been on the front lines of this pandemic. What is abundantly clear is that this pandemic is not yet over. Cases are spiking across the country, and we will need the Guard as we navigate the next phase of this pandemic. So what is the role of the National Guard in this pandemic? Here's U.S. Representative Chrissy Houlihan to give us the answer.
Changing needs. The National Guard, as we've noted, has played an absolutely essential part in our COVID-19 response and recovery in all 50 states, in Washington, D.C., and in 3 territories. And they have served as a critical tool for states to utilize for their unique and changing needs. Here at home in Pennsylvania, our Guard has been used, as we heard, for a range of missions, such as supporting testing sites, assembling testing kits, conducting contact tracing, staffing food banks, and, as we've heard, assisting long-term care facilities. We here are just so very proud of the work that they are doing, and the federal government, myself included, should put its full support behind their dedication to serving our country.
Throughout the pandemic, the Wolf administration has been working diligently to assist long-term care facilities with any needs they have. This work is particularly important as we see an increase in cases. A team of staff is working to assess where outbreaks are occurring and providing resources. These resources may include infection control expertise, connection to testing resources, and working to assist stakeholders with questions. So what is the impact of National Guard to long-term care facilities? Here's Department of Human Services Secretary Teresa Miller to tell us more. Take a look.
In the last 8 months since COVID-19 first reached Pennsylvania, our knowledge of how to manage this virus has improved, but outbreaks are still occurring, and this is still a great risk. We've established a system of support networks to assist long-term care facilities if they experience an outbreak. The ability to use the Pennsylvania National Guard as part of this response is a big part of this support network. We must continue to be able to utilize the Guard's support in the weeks and months ahead. Cases are surging in Pennsylvania, as we know, and around the country. We're headed into what will likely be a very challenging winter and flu season. Removing these resources as the threat becomes more acute will make Pennsylvania and other states less prepared to react nimbly to what's ahead.
One of the primary resources the administration can offer is support from the Pennsylvania National Guard. The National Guard can provide staffing support to assist in patient care, as well as providing support services such as preparing meals, cleaning, etc. This work has been invaluable to assist where there are shortages due to COVID-19 to ensure residents are receiving the care they need and deserve. Members of the Pennsylvania National Guard has served the equivalent of 7,051 days as part of the COVID-19 response. In Swarthmore, Pennsylvania, Myla Simbulan, Eagle News, we live in interesting times. Back to you, Anna.
Thank you, Myla. Yes, I think everyone can agree that the National Guard has been a great support, as mentioned, in all the 50 states. So it's pretty obvious that if they don't, reauthorize Title 32 over there, what would be the impact?
So, Anna, without federal authorization, Pennsylvania would have to consider placing the Pennsylvania National Guard on state active duty. And that means the state would be financially responsible for all those things that they're doing. So also federal authorization provides more protection for members of the National Guard for healthcare and benefits. So it's really important, Anna, that on the federal level, they will authorize the Title 32. Anna?
Yes, absolutely. So hopefully with the changing of those in charge, that could change. Right, Mila?
Hoping to, Anna.
Well, thank you for your report. A pleasure to have you on tonight.
Thank you. You too.
As the country battles a second wave of coronavirus cases, the state of Nevada launches Stay at Home 2.0. Plus, Governor Steve Sisolak tests positive for COVID-19. In Las Vegas, Eagle News correspondent Lori Jarvina has the details. Lori?
Thank you, Anna. During a press conference this past Tuesday, Governor Steve Sisolak sent a strong message to Nevadans that if the COVID-19 data doesn't improve in the next 2 weeks, he will be forced to take more drastic action. For now, he is asking Nevadans to voluntarily stay home for the next 2 weeks. Under what Sisolak is calling Stay at Home 2.0, residents are encouraged to limit going out in public to do non-essential activities, including having get-togethers with those outside of their household. He recommends ordering groceries or picking up food curbside instead of indoor dining. Employers are also being asked to allow employees to work from home for the next 2 weeks and hold meetings virtually if possible. COVID-19 cases in Nevada have been on the rise, with a record 1,906 new cases be reported in a single day yesterday, with an average of 1,214 daily over the past 2 weeks. Hospitalizations are increasing, but staying within capacity at this time. Here in Clark County, the cumulative test positivity rate within a 14-day period is at 11.1% from this past Monday, compared to 9.2% 2 weeks ago, and case rate per 100,000 is 701 compared to 490 2 weeks ago. If this trend does not improve, Sisolak threatens to once again enforce restrictions, but no details of that plan was specified. He stated, and I quote, "For the next 2 weeks, we must mimic our stay-at-home behaviors from this past spring. If we do so, we believe we can begin to turn around things in 2 weeks without having to place increased restrictions on our businesses or our schools." Then on Friday, just a few days after the announcement of Stay at Home 2.0, the governor himself took a routine COVID-19 test, which provided a positive result. So Governor Sisolak wanted to inform Nevadans immediately of his status, emphasizing the urgency of necessary precautions for the state. According to Governor Sisolak, the only symptoms he has experienced is fatigue, which might also be attributed to his demanding schedule. This is another warning of positive COVID testing, but an example of an asymptomatic individual who shows little to no signs of actually having this virus. On a positive note, the city of Las Vegas is launching additional community-based COVID-19 testing sites, which are scheduled to open beginning Tuesday, November 17th. The first site is at Doolittle Senior Center and will be open November 17th. In addition, a site at Veterans Tribute Career and Technical Academy is scheduled to be open November 19th through the 20th. Also, a site at Centennial High School will be open December 3rd and 4th. The times for each location varies to accommodate for mornings starting at 8 a.m. until evenings until 5 p.m. These sites will be open to the public, and tests will be administered on a first-come, first-served basis. Testing is recommended for both symptomatic and asymptomatic individuals. The Southern Nevada Health District, the Nevada National Guard, Guardian Elite Medical Services, and American Medical Response are operating these sites in partnership with the City of Las Vegas and Clark County. It's not surprising to see the rise in numbers, as medical experts state health officials have warned due to COVID fatigue. People are growing tired of wearing masks and social distancing. Add to that the change in weather. We're in the fall now, and people are staying more indoors. And all of these are driving the surge in cases. Nevada Governor Sisolak's recent diagnosis is a case in point to not let ourselves become complacent as we face COVID-19 surges here in Nevada and throughout the country. We can't let our guard down. So please stay safe out there and keep those masks on. In Las Vegas, Nevada, Lori Jarvina, Eagle News. We live in interesting times. Back to you, Anna.
Thank you, Lori. You know, this lockdown due to the pandemic it's definitely something that we don't want to see a version 2 of, right? So how do you feel about the stay-at-home 2.0?
Well, actually, Anna, you know, since we've had lockdown, we basically continue doing the same thing, which is ordering groceries online, having them delivered, and only curbside pickup for, you know, restaurants or takeout food. So this 2.0, personally, it's not going to change how our family is attacking this virus and doing our part. And like what was mentioned earlier, you know, if everyone got on board and took this as seriously as, you know, our leaders want us to take it, then we should definitely continue doing our part. And 2.0, I'm on board. Let's do it. Let's get this pandemic over as soon as possible.
Absolutely, especially right now with, you know, Thanksgiving around the corner. I hear people talking about plans. It's actually been half and half. What about you? What have you heard anything from those in your circle, maybe from work? What are their plans?
Well, for like Thanksgiving coming up, our in-laws just live, you know, 10 minutes away or so. So they'll be coming over, and that's it. And in fact, those are the only other people we see outside of our immediate household. So those are plans to look forward to, but definitely still taking precautions.
Yes, absolutely, and stay safe. Well, we wish Governor Steve Sisolak the best. Hopefully he stays asymptomatic besides feeling fatigue, and hopefully he feels better. Thank you, Lori, for your report. Pleasure to have you on.
Thank you, Anna.
When we come back, updates from our Eagle News correspondents in Seattle, Washington, North Hills, California, and Baton Rouge, Louisiana. This is Eagle News America. Stay with us. You're watching Eagle News America. I'm Anna Cui. Washington State, ground zero of COVID-19 here in the U.S., now joins other states preparing to battle a possible second wave of coronavirus. In Seattle, Bureau Chief Frendel Feheran joins us this evening.
Thank you, Anna. Washington State is indeed riding a raging wave of COVID-19 cases. Before this weekend, Washington faced a surge, the second wave, towards the end of July. Now we are on the third wave and reported to be the most dangerous. As you could see here on the graph provided by the government's office, on November 1st, there were 814 new cases. Just the other day, there were more than 2,000 new cases. Governor Inslee tweeted that today is the most dangerous public health day in the last 100 years of our state's history. Cumulatively, today we stand at 127,731 confirmed cases, 9,281 hospitalizations, and sadly 2,519 deaths. Total tests that were taken is 2,748,782. Now, what is the state doing about this resurgence? Today, Governor Jay Inslee held a press conference and announced the following restrictions effective November 16th through December 14th. Restaurants and bars. Closed for indoor service, outdoor dining, and to-go service permitted following current guidelines. Table size limited to 5 for outdoor dining. Religious services limited to 25% occupancy or no more than 200 people, whichever is fewer. No choir, band, or ensemble performances, but soloists permitted. No congregational singing and face coverings required at all times. Now, fitness facilities and gyms closed for indoor operations. Outdoor activities permitted, however, yet limited to outdoor gathering restriction up to 5 people. Now, indoor social gatherings prohibited with people outside your household unless you quarantine for 14 days prior or 7-day quarantine and a negative COVID-19 test. The holidays are coming up and we need to be aware that indoor gatherings is one of the leading causes to COVID-19 uptake, not only here in Washington, but nationwide. A simple guide to gathering is to have fewer gatherings for a shorter amount of time with smaller groups of people to be safer. Heeding to restrictions is only going to help. The state government also recognizes the harm that this pandemic is creating with closed business operations. Governor Inslee announced today and tweeted another $50 million to help mitigate the impacts on the businesses and workers. The goal is to have the funds out as grants and loans before the end of the year. Our state is amid a third wave that is more dangerous than we've ever seen. For our own safety, for the safety of our family and our community, to assure that hospitals can remain well-equipped and efficient in treating patients, as Washingtonians, it is crucial that we all show our importance to the guidelines. Seattle, Washington, Frendel Verheeren, Eagle News. We live in interesting times.
Thank you, Frendel, for that report. Stay safe out there. Over $135 million from the CARES Act funding provide ongoing food resources to financially impacted communities throughout Los Angeles County. In North Hills, Marianne Borja reports. Marianne?
Thank you, Anna. From the total of $135 million CARES Act funding, $10 million was allocated to the Los Angeles Food Bank, $15 million to Great Plates Delivered, $60 million to senior meal programs, $50 million to grants and new food programs like Baby to Baby, and $2.1 million to food programs intended for those who are homeless. Since the beginning of the COVID-19 pandemic, with its social media hashtag Let's Feed LA County, County has supplied more than 4 million free meals to struggling residents and continues to do so. With so many families financially impacted and in need of assistance to providing food on their tables, the county is dedicated to ensuring that no one grows hungry as many departments work together to help those in need, from young children to the elderly, of food resources during this time. According to county statistics, there have been more than 50 free food drives held in different areas of the 5 supervisorial districts of Los Angeles County, serving an approximate 5.6 million pounds of food to around 83,000 households so far, which equals to over 250,000 residents. The Los Angeles County Workforce Development, Aging, and Community Services bring 3 restaurant meals a day to the homes of qualifying seniors through their Great Plates Delivered program. Currently, there have been about 1.9 million Great Plates meals delivered to seniors' homes, supplying 7,387 elder residents with 3 meals each day. County partnership with the nonprofit Baby to Baby organization benefited 110,000 families in Los Angeles with free infant formula and other basic necessities. In addition, the Los Angeles Regional Food Bank continues to distribute free food boxes to residents. Just last week, they were at the Veterans Memorial Stadium and Castaic Lake State Park for their scheduled food distribution events. In North Hills, California, Marianne Borja, Eagle News. We live in interesting times. Back to you, Anna.
Thank you, Marianne. Certainly, one of the positive things about the pandemic is that we see all these great programs provided by, all of the cities, especially there in Los Angeles. And I do see a lot of people are coming out and taking advantage of that. How are they making it safe, for even going to the food distribution centers?
Anna, there is that concern, and it actually is very safe because county officials and staff who run these food drives strictly follow physical distancing protocols and wearing of face coverings, as well as the frequent use of hand sanitizers and sanitizing wipes. Most are drive-through venues, so no need to leave your car, as the staff will just put the food boxes right in your trunk. It's full service, very easy and quick.
Yeah, we've definitely gotten used to social distancing. Even when you go to the store or anywhere in public, it's just you just have that that instinct to kind of give people way for themselves. So it's a good thing, right, Marianne?
Right.
Well, thank you for your report, Marianne. You stay safe.
Thank you, Anna. You too.
Several stories from our Louisiana Bureau tonight. First, the Louisiana governor's staff member tests positive for COVID-19. Louisiana to remain in phase 3. East Baton Rouge Parish COVID cases increase. And New Orleans announces COVID-19 live entertainment permitting process. In Baton Rouge, Monique Velasco with the details.
Thank you, Anna, and hello from Baton Rouge, Louisiana. On Thursday morning, the Office of Louisiana Governor John Bel Edwards disclosed that a staff member tested positive for COVID-19 on Tuesday evening. The employee did not have any close contact with the governor and is currently in isolation. Another staff member who has appeared to have contact with this person is also quarantining for 14 days per guidance from the Centers for Disease Control and the Louisiana Department of Health, which reported Sunday that the total positive cases in the state has reached 204,513 since the start of the pandemic. From these cases, 176,107 patients have recovered as of November 9, with a total of 6,132 deaths, 753 patients currently in the hospital, with 58 patients on ventilators. In a statement Thursday, Governor Edwards announced that Louisiana will remain in phase 3 and keep its current COVID-19 mitigation measures in place until Friday, December 4. He stated that as we move into the holiday season, it is important that people do not let their guard down. We have seen COVID spread because of small, private gatherings at people's homes, and everyone should be focused on minimizing their risk and protecting their loved ones. Here in East Baton Rouge Parish, Mayor President Sharon Weston Broome also stated that the rate of positive cases is moving in the wrong direction with the COVID-19 pandemic, with the Louisiana Department of Health reporting a 5% positivity increase. She stated, "We cannot give into COVID fatigue, and that in order to protect our health and keep our economy open, we must double down in our efforts by wearing a face coverings, avoiding crowds, getting a flu vaccination, and getting tested if you have COVID-19 symptoms." Meanwhile, the city of New Orleans announced on Tuesday that a new COVID-19 live entertainment permitting process is being put into place. Mayor Latoya Cantrell stated, "We know that our culture bearers provide the pulse of this city, and my administration has worked closely with the leaders of New Orleans' cultural economy throughout the pandemic to find creative ways to safely provide the entertainment that is our lifeblood." Live entertainment, which includes musical acts, theatrical plays, stand-up comedy, magic, dance performances, DJs, and more will be allowed in outdoor and some indoor settings with either a special event permit or a certificate of registration issued by the Department of Safety and Permits. In compliance with guidelines from the Louisiana State Marshal, singing, karaoke, and wind-blown instruments will only be allowed outdoors, and live entertainment is not allowed indoors in bars or breweries. Anna, I hope you're staying safe and healthy there. In Baton Rouge, Louisiana, I'm Monique Velasco, Eagle News. We live in interesting times. Back to you, Anna.
Thank you, Monique, for your report. And yes, hopefully you stay safe out there as well. When we come back, learn how to make grilled salmon with avocado cucumber salsa from some of our ABC friends in Hawaii. And for tonight's virtual roundtable discussion, we will talk about how we help take care of the environment. That's in observance of America Recycles Day. This is Eagle News America. Stay with us. You're watching Eagle News America. I'm Anna Cui. The nation is currently facing a second surge of COVID-19 cases. Many states are considering tightening restrictions to curb the spread. While we do our share in this mitigation process, let's add to our list of things to learn while quarantining: how to make grilled salmon with avocado cucumber salsa. Sounds good, right? Well, you bet it tastes even more delicious. Our ABC friends in Kaneohe, Hawaii, I hope I pronounced that right, the Olipares family shares with us this recipe. Let's take a look.
Today we're going to be grilling on the grill some salmon topped with cucumber and avocado salsa. Okay, let's begin. So we're going to mix this all into a bowl. So we're going to mix 1 teaspoon of salt, half a teaspoon of pepper,
Okay, wala. Not too much though. Okay, mommy, turn now.
2 teaspoons of the chili powder, and 2 teaspoons of the cumin.
This one then. One more. That's too much. 2.
You can use your hands. Just like that. Then we're gonna put the salmon in on like that on both sides. And it should look just like that. Now it's ready for the grill. You want to turn on your grill or light your grill with the wood. First thing on your grill, you need to preheat your grill. Get it nice and hot, ready for the fish. After you preheated your grill, put the fish on the grill. And you leave it on one side for 5 minutes, and then flip the other side for another 5 minutes. We're gonna need 1 avocado diced, 1 cup of diced cucumber, 1/4 cup chopped cilantro, 1 lime juice, 2 teaspoons of olive oil, and a half teaspoon of salt. So you put everything into the bowl, the avocado diced, and then the 1 diced cucumber, the chopped cilantro, and you mix it all in. Oh, and also the lime juice.
No, let mommy do it then. Hold on. And your turn.
And you mix it. Okay, now when your salmon is done on the grill, we're gonna put it on some lettuce. And lay the lettuce on. Put some lettuce and put the salmon on. And then we're gonna put our salsa topping.
Well, that was really enjoyable. Thank you to Olipares family. Certainly enjoyed the young sous chef they had there, right team? Hopefully her enthusiasm for helping will grow along with her. So thank you, Olipares family, and more so, we'd like to continue to thank our healthcare workers, first responders, and essential workers with a round of applause. Let's join team in giving them that round of applause. We do appreciate you more so now with the rising in numbers. That is our Eagle News episode, Eagle News America episode today. Thank you for joining us. I'm Anna Kui. We live in interesting times.